together and integrates other economic and epidemiological impact models for various policies such as mobility restrictions and vaccination campaigns. It also allows us to take into account complexities such as new virus variants, how stringent our policies are, and what can happen with fatigue or lockdown fatigue. It includes the health outcomes and economic effects, including effects on poverty and inequality. This type of model fills a crucial gap. There's now a lot of evidence related to economic and health impacts of policy responses, but there is little systematic evaluation of the evidence, especially regarding combined effects on trade-offs, especially with respect to the distributive effects of these policies. This means that this work is extremely relevant. It goes beyond COVID-19 and it provides an important basis for our overall pandemic response in our countries. Thank you very much. Thank you, Ana Milena, for that introduction. Now we will hear from Eduardo Levy, and Adolfo Rubenstein, who will tell us about the results of COVID policies in Argentina, Brazil, Mexico, and Jamaica. Also, our research team will show us the application online. It's freely accessible to everyone, and we'll give you a chance to try it. And of course, we encourage you to use the chat and participate and ask all the questions or give all the comments you'd like using the question and answer button as well. Adrian and Eduardo, welcome. It's a pleasure to have you with us. You have the floor. You're muted. Good morning, everyone. Thank you very much for this invitation. I'd like to thank Pablo Ibarrarán, Sebastián Bajo, and all the IDB team that supported us in developing this integrated model for understanding the economic and social impact of COVID-19 in our region and in our country. I will share my screen now. I hope you can all see it. This is work that we did at the clinical and health effectiveness department and the Department of Evaluation of Technologies, and together with Eduardo Levy and our other colleagues from the Torcuato Itel School in Argentina. This is a collaboration with them. And an important aspect of this simulation is not just the fact that we've integrated health, economic, and social aspects in a single model, but it's also the very fruitful collaboration that has allowed this to be developed. And collaborations are not always easy among various disciplines, as you know. In terms of some background, we started about 3 years ago, and we've always been receiving the support of the Inter-American Development Bank and the World Health Organization for this. And we started on a dynamic transmission model. And especially in 2020, we still did not have vaccines available, and social and health policies were the only tools that we had to mitigate the expansion of the pandemic. And we developed this model in order to evaluate the readiness and the response of the countries in the region when faced with this pandemic, and looked at the epidemiological trajectory in each country and resources in beds in hospitals, etc. And this evolved, and when the vaccines were made available with the help of the World Health Organization and the IDB, we also looked at the impact of various vaccination strategies in the countries of the region. and how this modulated or mitigated the effects of the pandemic. And we also developed a cost effectiveness model in terms of increasing vaccination rates compared to other practices, no vaccination, looking as particularly at a no vaccination scenario. And that's how we developed a cost effectiveness model for our vaccination strategies when faced with a pandemic. And to develop this model, we incorporated compartmentalized models, taking into account the home, school, work, and public transportation, and community. And based on all this, we began to develop the integrated epidemiological and economic impact model for Latin America. And the goal was to understand how to integrate the impact of deaths and serious disease and the social and economic impact in terms of loss of GDP and based on gender or income of families, of all these non-pharmacological measures, these public health and social measures that were implemented in the selected countries, in this case, Argentina, Brazil, Mexico, and Jamaica throughout 2021. That's the period of time taken into account, and that is probably the time when the pandemic had its greatest impact. So basically, this epidemiological and economic impact model is a dynamic transmission model like the SEIR, except we added the V for vaccination. And basically, we incorporated the impact of mobility restriction measures and how these, in turn, meant that there were fewer working hours in different sectors of the economy. And Eduardo will be explaining this in terms of production and consumption. And this in turn interacts with the various vaccination strategies in each one of the countries. And it's an interactive open code model. You can use parameters, it's very transparent, and you can, the final user or decision makers can select the variables and the various vaccination campaigns. You'll see when Adrian will show you the model as it works in order to anticipate the potential impact of all these measures. This is the dynamic transmission model. You can look at the various phases and each one of them susceptible, vaccinated, exposed is related to transition that will happen in this transmission model. And the expected result of this model is that we will be able to measure the trade-off between the health impact, serious disease, serious hospitalizations and deaths, vis-a-vis the economic impact, loss of production, consumption due to mobility restriction. Also, we're taking into account gender and income level. How does the EPI econ model work? It helps us quantify the trade-off between the epidemiological and the economic impact, and it can be configured for different scenarios in terms of intensity, rigorousness, as well as duration. And the economic framework moderates the impact of these, or models rather, the impact on hours worked, etc. And it has another factor that we call lockdown fatigue. And it has to do with the fact that people are less likely to obey lockdown measures as the duration of these restrictions continues. And this is important. It's important to adjust for this. And Eduardo will be explaining this. So we understand the difference between de facto measures and legal measures, de jure measures. And so what we can do is basically we use a slider to adjust and understand how these measures are taking or having an effect. This is how the model works. You have the outputs of the epidemiological model here. Basically, this is deaths and hospitalizations with serious disease. And this is a reinforcement of the restrictions. The more we comply with the measures, the better we fare here. That's what the epidemiological model shows. So, and this reduces lockdown fatigue, but as these continue through time, at some point, this variable increases. These frustrated accumulation or frustrations accumulate, and this reduces adherence. And you can see that there's an impact on, or mobility restrictions have an impact on the workplace, and this will affect different parts of the economy in different ways out of the 16 sectors of the economy that we have analyzed. So we see number of hours worked. That's our input output model. Also, another variable is how capable various various parts of the economy are for remote work, also in terms of social strata. So there's a lot of factors that we need to take into account, including informal work. Then we also have assistance policies and again, the impact in terms of being able to work remotely or not. And then there's an effect on GDP, and this in turn has an effect on socioeconomic indicators stratified and classified by gender. That's how our model works. Here you can see how it's been integrated for each decision period throughout 2021. We have to re-execute it. It's a recursive model. You see the public health measures or the various restrictions, how these generate the outputs of the economic model, number of hours worked, and as these shrink, we shrink the number of deaths and serious disease. And then when the death rates go up, how this has an effect on the economic model, also generating a drop in GDP, depending on what sectors are being most affected by this phenomenon. So the economic aspect takes the output of the epidemiological model as input, while the epidemiological one takes into account the economic impact. This is just some equivalences between the public health measures in the epidemiological model and the restrictions used for the economic model, where we include rigorousness as a parameter. These goes from 0 to 3. Here we have physical distancing, then you can add the isolation of older people, then we add self-isolation, then school closures, etc. And now I'll give the floor to Eduardo. Eduardo, it's all yours. Thank you very much. Again, I'd like to thank the organizers of this event. I'll give you an example. I know it's very small, maybe you can't read it, so I'll describe it. I'll illustrate how both models or aspects of the model are linked. There are two important bridge or connection pieces here. We have the production in each country, the GDP, then we can see then an effect, the main indicator for all. But the connector is what Adolfo already mentioned, the relationship between the epidemiological output, in this case in particular, the number of deaths, recent deaths, and adherence to those legal official restrictions that Dolphy was measuring. And this is measured throughout the stringency or by the stringency measure. And what this shows here, the graph, you see the straight lines, those are the official measures. They go up or down based on the dynamic of the waves of the pandemic. And then we see in blue a much more erratic line. This is how we are measuring compliance levels with these restrictions. And this is measured based on what we can detect as mobility to and from work. We have a large population, and now we're focused only on our adult working population. Children and senior adults might have a different dynamic. Here we see by how much the number of working hours is reduced, and then that information feeds into the epidemiological level in terms of the circulation of the virus. But we need to highlight here that this difference between the official measures and actual adherence to the measures has as an input the result of epidemiological policies, because the number of recent deaths, and this is coming out of statistics, the number of recent deaths generates this fear factor, which means that people might be a little more likely to comply. And then that gradual drop off in compliance that we see in almost all the countries, it's statistically significant, and it has to do with fatigue, lockdown fatigue, but also certain economic conditions where poorer countries perhaps will have a lower compliance level because of labor precariousness, the lack of savings, or not having the right place to be in lockdown. This means that these people will be out on the street because perhaps they live in a crowded area in any case. So this is the point of contact between the two parts of the model, and it has a lot to do with this fear factor that we were talking about that has to do with recent deaths and how much time has gone by. So we measure it as intensity time. If you have very intense restrictions for a long time, this will have a negative effect on compliance, even more than if you have a less intense level of restrictions for a longer period of time. This is just an illustration by GDP. How much of what a sector or activity produces, this is very aggregated. It's 16 sectors. How much goes to final consumption and how much is an input for other sectors? Why? Because when you, for example, all of a sudden reduce mobility and transportation, this as an input affects other sectors. The intensity or level at which this affects different sectors is seen here. This is not the matrix. This is the list of sectors, but it's direct participation. We look also at how many of these sectors have an effect on the activity of another sector and which ones are essential. And some of them were declared as essential sectors in some countries for that very reason. And let's think about the following. A country with two sectors, that's an example just of differential effects. A sector that has a lot, requires a lot of personal contact versus one where you can do everything remotely. Naturally, you would restrict the one with more personal contact, but perhaps it represents a greater proportion of the GDP. So these measures will have a greater effect overall. Also, if I have two sectors and one has more women working in it, intensive level of personal contact, more women. So in terms of income and labor access, the same restrictions in this country were the most affected sector is more feminized in quotes, then I will have a bigger gender gap than in countries where this distribution of women in the workforce is more uniform. Same with poverty. If I have two sectors and the most important one is one with high personal contact, low qualifications, low income, and that's the most affected sector, then that country will have a response in terms of a greater increase in poverty than a more developed countries where most of the workers are more highly qualified and work in sectors that are less sensitive to these measures. This is what will give us this differentiation between countries. And so you'll see that in our sample, not all the countries gave the same response or had the same results based on gender or income levels. Here we'll very briefly show you some results. This is very hard to read, I know, but this is the way that we calibrated our measurements to what happened in 2021. And it's important to highlight that the model is calibrated for what actually happened. In the model, we incorporated the shock that each country had, and it differs according to the country, but it's the same model, and we can calibrate it maybe not to reality, but to other scenarios. The user can use it to simulate the same scenario in different countries. It's not what we did, but the model is easily adaptable to do this more abstract work for a next pandemic, for example. Now, having clarified this, I'll show you some results. I don't know how clearly you can see this, but what we show here are the three main graphs of the simulation. The first one is our measure of output or outcome, rather, epidemiological outcome, deaths per million throughout this period. And this is basically referring to 2021 with more or fewer restrictions. Where we have more restrictions, you see that peak of the line that's red or orange is higher than that for the second scenario. And simply because there are fewer restrictions and thus the number of immediate deaths is greater. We did not flatten the curve. On the economic side, it would be the opposite. The red line would have less of an economic impact because fewer business hours are lost than if we had more restrictions. So that's the implicit trade-off that we see there. It's a dilemma in the short term between health restrictions and restrictions on the economy. On the right, we have that trade-off exactly. On one axis, we have health losses measured as deaths, and on the x-axis, we have economic losses. And clearly, the curve is negatively correlated because at the bottom right, we see that the more restrictions we have, the more economic losses we have and the fewer health losses and vice versa. Here we see we have two curves or straight lines rather. At the bottom, the lower one is for the first semester of 2021, and the second one is for all of 2021. Clearly, when we look at the entire year, in losses are greater in lives and in economics, but we see differences between these lines. And as we were doing our work, we saw that this is due to the fact that when you move forward with restrictions for an entire year, there's that lockdown fatigue. And so their effectiveness is lessened and the trade-off changes. So it's a steeper curve. The cost in economic terms of reducing deaths is higher because you have to impose much more stringent restrictions in order for them to be complied with, because the inclination to comply with them is lower. So these three snapshots are what we have as a reference for the model, the comparison in terms of health, economy, and the trade-off for the same case, how you prioritize health and how these how this affects the economy. Here, based on gender, we have more examples, but I don't want to go into it too much because we don't have time. Here we have the gender disaggregated by gender. We did this for all the countries, of course. And there are some differences among the countries, but what we identified is that the impact of the restrictions has been substantially greater for the more vulnerable strata of society. For those workers, economic impact is exclusively for our working age population, and the same happens for women. And the greater the restrictions are, the broader this difference is, and the interpretation we have, and I'll give you an example, is that if we imagine there's one sector, like household workers, very feminized areas, or sectors such as construction, which is a more masculinized. Construction was included in the protocol, but domestic workers were practically excluded because of these restrictions. And inevitably, when we have these more highly feminized sectors, we see an impact that has an effect on income and on access to work that really affects women more. And the same happens with income. If you reduce those contact jobs in construction and others, but more sophisticated workers can generate protocols so that they can continue to work, then we will have a greater impact in terms of lost business hours in those lower salary sectors.
So what we confirmed with the simulation, based on what I was saying before, the composition by industry based on work, income, and gender for every sector, what we confirmed was that the impact is not neutral, neither in terms of income or in terms of gender. Here, what we are doing is comparing the trade-offs for each one of the countries, the dilemma in the short term, because in the long term, economic losses also have an impact on health. But in the short term, if you increase restrictions, you also improve the epidemiologic results. There is an impact on the economy, and here we can see the different trade-offs for each one of the countries. It's interesting to see the lines for each country. In the future, we should be able to prove that the most acute lines, the most steep ones, would mean that we could save more with that those lines are associated with some sort of quality element. For example, the policy in terms of epidemiological matters. But right now, most lines are similar there. So basically what we're capturing is not something of a specific country, but a much more generalized pattern that affected all countries. Next slide, conclusions. Well, I think we've already mentioned them. Conclusions of the analysis. Yes, there is a trade-off. The trade-off goes against restrictions as time passes by, mainly because of the adherence to the measures that are being implemented. The trade-off and the social and economic impact of restrictions is not blind to gender or income, and rather it actually affects or is much more harmful in terms of income for women. And here we didn't take into account the fiscal transferences. We're talking about work inclusion, income, it's worse for those with lower income levels and women. And then in terms of the impact, like I said before, it's equal among countries, but there is some sort of regular trend that is important to highlight based on those lines. One would have expected more differences among countries, but honestly, the pattern is really not that different from country to country. And that is all I had. Thank you. Thank you, Eduardo. In our model, what we also saw was that the impact of the trade-off between lives and livelihoods is much less pronounced as the vaccination campaign takes place. We have quite a good interaction between public health measures, the vaccination campaigns moving forward, and the epidemiological results, as well as the social and economic results. So it's very important to understand the very positive impact that the vaccination campaign had at all levels. Over to Adrian now, who will talk about the model. This is the team that was involved, and now Adrian will talk about how the model works in the real world. Good morning. Thank you. Thank you, Adolfo. I will now share my screen. So what I would like to show now is the application that is available online. So you can see the results. This is the graph that Eduardo shared. And that's basically the model, the engine of this application, which is available online. You can see the results. Like Adolfo was saying, we developed this interface for the user, and it can be customized to the different stakeholders or the different uses that you want to give to the model in order to build different counter factual scenarios or basically to customize it to specific situations. We try to reach a balance between a very simple interface so that it's very user-friendly and it's not only available for those that are specialized in using this type of simulation models, but we also want to make sure that there's a complex engine behind it, so to speak, so that it can represent very complex situations. The application is based on open code. Any type of user can access this code. It's full, it can be clonated into a computer, it can be modified, and so on and so forth. At the first screen of the app basically allows you to choose a country. We developed the model for 3 years, and slowly and increasingly we added different functions to the model. Some of the functionalities was the number of countries that could be for which the model could be used, basically. It's available for it was available for Argentina, Mexico, Brazil, and Jamaica, but now we have all the countries in the region here, because we added all of them, basically. Then you have a general information panel, a map, a color-coded map in order to assess the current situation regarding COVID and how it is affecting the countries in the region. And this is the main graph where you can see the 3 simulations, epidemiological simulations, basically the number of cases, deaths, and the intensive care unit beds that are being used. In the case of deaths and COVID cases, you can overlap both graphs to see them. This is the general situation in epidemiological terms of the simulation and is available for countries. As Adolfo mentioned before, the model also includes the impact of the vaccination campaigns. So you can adjust the effectiveness and the coverage of the vaccines. And then the next panel basically by default shows for each country the sequence for 2021 of the policies implemented by each country. This is not fixed. It depends on the country that we choose at the beginning. on the first screen of the app. And it uses available evidence. In some countries, the evidence available is really not that much, but it takes into account all the different restrictions. We have basically 5 categories here that are color-coded, and then based on the restrictions, these categories have an impact on the different matrix, and you see how effective they are or not. The model takes into account the transmission of the virus, and it takes into account also how the different age groups are infected and how these groups lead to an effective transmission of the virus. So these policies can have an impact on the effectiveness and the transmission. So for example, the use of mask reduces the effectiveness of contact, but it doesn't really reduce how people are infected. They're infected in the same way in terms of number of cases, but by using a mask. Therefore, you will have the same number of contacts, but less infected cases because of the use of a mask. So we have 12 consecutive months to be projected here. And then in the third section, you will see different tabs that will reflect different dimensions of the model, covering the different stages of the research over the last 3 years. This is a summary table. And in the last 2 tabs, you can see what Eduardo presented before me. First, we have one that says Eco Model. And what you can see when you click on this tab, and I'm going to wait for a second because it takes a little bit to upload it, but it's 2 graphs. In one, you can see daily deaths in the base case, which is the case for the configuration of policies that I just showed, and the counterfactual case. And this case is determined by this configuration right here. So what the interface allows you to do is to change the scenario and adjust it to your own situation. That's the one represented in the orange line. So right now, by default, that you can see what I have on my screen, but you could actually change it and compare the base scenario, which is the real scenario, with different counterfactual scenarios. That's the idea of the application, for you to adjust different categories by month and see the different scenarios in terms of economic losses compared to loss of GDP, number of daily deaths. Then you have graphs that are broken down, for example, by gender in this case, and by poverty rate. And here we have the other segments that have to do with gender and accumulated deaths. All the graphs that Eduardo showed are now included here in the app, and you can change the country and see all the graphs for each country. And again, like I said, you could change the different elements to and counterfactual scenario to compare it with your real scenario. And finally, if you click on the last tab, you have the trade-off graphs. Eduardo mentioned it in his presentation. You can see the line of the trade-off annually or during the first half of the year, and then you can see the correlation to the level of restrictions and the level of losses. As I said before, we use our language here. It's published in the website that I mentioned, where we did this interactive visualization. And now in a few minutes, I will share how you can access this application, which is online, as well as the GitHub repository. Thank you. Thank you, Adrian. I have a final comment, and it's the following. It's important to highlight this is an open code model. It's absolutely available. It's absolutely customizable to the different preferences and needs of whoever is interacting with the model. Which should be very important for the decision-making person, and it's also one of the greatest advantages of this model. Thank you very much. Thank you to the three of you. The presentation was very comprehensive, and in spite of how complex the model is, I believe that the application was explained very clearly. Now, to talk about this, we have the honor of having a very interesting panel. Victoria Fan, who is a Senior Research Fellow in Health for the Center for Global Development and conducts research on a variety of topics, including pandemic preparedness, effectiveness, and health systems financing. James is the Director of Health Systems and Services of the Pan American Health Organization. He oversees the PAOS program of work in health policy and governance, organization of health systems and services, health workforce, finance and research, access to medicines and health technologies in the Americas. It's a pleasure to have you both to open this discussion. Personally, I would like to highlight the importance of including equity. I think that's one of the main contributions of the model. Now, to have a deeper discussions, I would like to offer the floor to Victoria and James. Go ahead.
Thank you very much for this invitation, and I want to give congratulations and kudos to the team that has built this extremely valuable and important work. It's so comprehensive and covering so many different sectors, really gets to the trade-off between the health outcomes and the losses to the different economic sectors, and potentially benefits as well. And it also draws on a broad set of information that can help inform decisions and policymakers. And I want to emphasize that because although COVID is a health condition, it obviously, as we all know, has had many impacts across many different sectors. And so the fact that this has an interdisciplinary collaboration between the epidemiologists and economists is quite rare and extremely valuable. And I also want to acknowledge and appreciate the fact that this code is open source and customizable and has data visualizations easily accessible. Is also not so common. If you go to the CDC website for the United States, there's maybe 20 or 30 different epidemiological models, and they vary in how accessible they are. So I just want to thank the team here for making it open source. There's many different unique contributions to this work, but actually what I want to focus on briefly is more from the uses and the applications of modeling and forecasting for decision-making. This work is an important use of what I would consider a retrospective approach to sort of simulate or imagine what might have happened under a different scenario. The word counterfactual is often not understood so easily by policymakers, at least in the United States. And the word scenarios, alternative scenarios, is somehow more understandable. So I should say that I'm speaking actually from my own experience as the chair of our COVID modeling task force in the state of Hawaii, which is a state in the Pacific. And we had a similar sort of interdisciplinary work group involving epidemiologists and economists, but also biologists, social scientists, and public health professionals to help us use different types of models. And I also just want to mention that, although this particular case uses sort of a retrospective perspective over the past 2 or 3 years, in many cases during the pandemic, the use of modeling was actually from a prospective perspective, right? And so in those cases, there are 2 types of approaches. One is a simple forecasting function, that is to say, how many cases may we get under a business as usual or no changes in policy, as well as public behavior, that is if nothing changes. And I mentioned that no changes in public behavior because in the case of Hawaii, we recognize that by presenting the forecast of what the COVID situation may be, people's behavior would actually also change voluntarily without the use of a mandate, potentially. And I just mentioned that as an alternative way to think about tools. When we think about our COVID tools, this paper is very comprehensive in outlining the sort of traffic light approach of the different stringency of measures. But I do think one really important tool is the ways in which we communicate the potential effects of the pandemic. And so in our COVID modeling work in Hawaii, it was a recurring theme where when we talked about forecasting, we would tell the public, this is what's going to happen if nothing changes. And of course, our model was wrong because we knew after telling the people and the public this, that people's behaviors would actually change. The other thing I'll mention, I think Eduardo mentioned the word fear. And I think that is one important motivation, but I actually think if we broaden that, and in Hawaii this was particularly true, was not only a fear for oneself, but actually a fear for one's family members, and which I actually think is not necessarily a form of fear, it's actually a form of concern, sort of an altruistic sort of love and care. And when you talk to people, they would say they're very concerned about their grandparents, and that's why they're taking more precaution. And so I think tapping into that sort of motivation and communication for people to take voluntary restrictions can be less stringent and costly than these sort of de jure sort of measures where it's sort of enforced on a blanket wide approach. And I think to some extent, countries in East Asia, South Korea, even New Zealand and Taiwan, for example, they tended to use, tap into the need to get buy-in and support for these measures, and recognizing that none of these measures are effective if we don't follow them. And I think this paper also emphasizes that message as well. Well, I mentioned briefly about this use of forecasting, and the alternative is this approach that this paper uses, which is scenarioing, if I make that a verb, and this case uses a retrospective scenarioing. There's also prospective scenarioing, which is to imagine what might happen, as the pandemic is occurring, and obviously the uncertainty with that is quite large. And I think there's also potential for misunderstanding and misuse. And we saw that quite a bit in the United States, where there would be models and forecasts used, and that led to even a lack of trust in the model itself, because then the results would change, or the cases didn't actually match what the forecast was. And I just want to emphasize that I think is a responsibility of the technical and scientific advisory, that we really need to be careful how we communicate the model. And that's also communicating what is the scenario that we're talking about. And also the other risk is that when you talk about scenarios, there's a risk that the modelers may be perceived as being on a political, spectrum, or having some political bias. And that also reduces the trust in the model. And so in the case of Hawaii, we chose not to do any scenarioing in public. We only focused on the forecasting function, which is the base case or the business as usual case. And we did all the specific scenarios with different ranges of stringency behind the scenes, so as to not be cast on actually both spectrums of people accusing us that we're too stringent or too loose. I think that's an important piece to just keep in mind for all of the modders. Just a big kudos, and I'll pass it over to James. Thank you.
Bueno, muchas gracias. Muchas gracias, Victoria.
Thank you, Victoria. I also wanted to acknowledge the study, Adolfo, the IDB, Eduardo, thank you very much for such an important piece of work. It's truly relevant in order to understand the social and economic impact of pandemics. The impact is long-lasting on countries in terms of their recovery capacity when a pandemic hits. I would like now to offer some brief comments about the work that has been done, not so much regarding the analysis of the results that have been presented. I believe they're truly interesting, but rather I would like to talk about the application of the modeling, as Victoria mentioned, in the region of the Americas. Something that I believe could be a great challenge for the modeling is the challenge that we are facing in the Americas due to the fact that the region is especially vulnerable given its high levels of informality, work informality, social problems regarding poverty, inequality, and then the main problem associated with to the fragility of the healthcare systems, which are highly fragmented and segmented. Societies with low levels of social protection, where you have a large part of the population that lives in high levels of vulnerability. For them, you need differentiated approaches. I believe that we have heard from Adolfo and Eduardo the importance of disaggregate and differentiate data broken down by the different populational groups, the ones that are more impacted by this type of event in the different countries, and the ones that are most vulnerable to this type of contact. Something else that I would like to highlight is the following. I believe that the application of this type of model implies that all control measures are available. We published 2 reports together with ECLAC in 2020 and 2021 regarding health and the economy. These 2 reports were truly interesting. They addressed 2 very different moments during the pandemic. The first one, countries were rushing in order to implement the most basic control measures, such as PPEs or diagnosis tests, such as PCRs, not even rapid testing. And then in 2021, where all the different control measures were in place, PPEs as well as COVID rapid tests. But we saw what we saw was inequality in terms of access in the region. It's very interesting to see the application of this type of model in different moments throughout the pandemic, where we see challenges associated to the different control measures that we have in place. The measure that we would like to share as an organization specialized in health was that if the transmission curve of the pandemic was not controlled, the economy could not be reactivated. And this was an initial stage. We had to insist with the different countries, especially with some countries. They thought we have to understand there was lack of vaccine and lack of control measures, and they thought that the economy could be reactivated, everything was under control, and nothing was going to happen. Several countries have learned very difficult lessons about this type of situation. Another thing that we saw, having a look at the data by the WTO and the performance indicators of the health systems associated to the results regarding the pandemic, is we've seen something very important that I would like to highlight, which is the following. Control, or rather, the application of control measures together with economic reopening normally requires very good and dynamic leadership. And it's hard to measure this thing in the application of the models. And this agile leadership is seen through comprehensive policies that include health policies on the one hand, of course, but also economic and social policies on the other hand. Part of this has to do with an approach that we need to take at a specific moment, such as where we are right now, but also in terms of the medium or long-term analysis, because we need to have the necessary functions and measures in place to strengthen health systems based on primary healthcare services, strengthening also health oversight, improve preparedness capacity of the different systems. We're going to face a similar situation in 10 years when we have the next pandemic hit us, and we need to be ready. One final comment. We, as countries in the Americas, adopted a benchmark, 6% of the GDP of the public spending in health, like 6 years ago, 2014. 6 years later, we only have 4 countries plus 3 that are getting close to that 6% that I just mentioned. Therefore, the situation is very complex. And it's very complex to also, it's very difficult to push challenges to, or rather to push countries to make the necessary changes. It's important to have this type of model in place as a mechanism, maybe to be used as an advocacy tool to convince countries to implement the necessary measures so that we are better prepared in the future.
So our recommendations based on what we've heard about this very interesting model, again, a recommendation is that we realize how important this tool is within the context of a policy discussion regarding those systemic elements that affect health and are exacerbated by inequality and lack of social protections in countries. And sometimes what is very important in the context of a pandemic, and in any context, is to work with countries on these principles for convergence between health and the economy. If we're not healthy, then our economy cannot make any progress, and we need to support countries regarding their policies for control and support and reactivation of their health systems. Thank you very much for that comment, for your comments and your thoughts. And thank you, Victoria. Unfortunately, we're running out of time, but we have a few minutes for questions. So I'll group a few questions together just because we don't have much time. And I'll thank you also to be brief in your responses. A few people have asked, since the pandemic is now over, how do you think this model can help the countries now regarding their COVID policies or in preparing for other emergencies? The other question, and I'd like to also take this opportunity to thank all our participants. We've had over 240 people connected, and many of them have asked why these 4 countries were chosen: Brazil, Jamaica, Argentina, and Mexico. What were the criteria, and what are the priorities in terms of improving information or data that is available? And also, where could we find more information about this model? Is there any publication? Is anything going to be published in the near future? And also, what are the new developments regarding this model? Thank you. Thank you very much. I'll answer the first question. As we were saying before, we configured scenarios for 2021. That was the highest impact year of the pandemic regarding epidemiology and also in terms of our economies. And it was also the year that vaccination campaigns were launched in the countries. And reality is that this model is not just for the COVID pandemic, it's also for possible future pandemics. And unfortunately, all the changes that are taking place globally, climate change, changes to ecosystems and migration and other changes make us think that unfortunately this will not be our last pandemic. So all the countries, I think, have learned a lot, many lessons from what has happened during this pandemic. And again, this model, what it allows us to do is to generate and configure scenarios, maybe hypothetical scenarios that allow us to anticipate decisions that need to be made with information from these models that can give us an idea what the potential impact of our measures is. It can be used for COVID now, but it's really an open model, and it could be used for any other pandemic. We hope that will not happen during this generation, but it's always a possibility. Regarding why we chose the countries we did for the sample, we wanted to choose Latin American and Caribbean countries. In the case of Argentina, Brazil, and Mexico, two South American countries, one North American, Latin American country, and Jamaica from the Caribbean. And yes, there was more data available in these countries, epidemiological data as well as economic data. That was one of the reasons. I don't think there was any other reason. I don't know if Eduardo has a comment about this. No, basically, we discussed it with Sebastian and the IDB, and we did want to, as far as possible, have, and with a reduced size sample, we wanted to cover the entire region. We included also a small country like Jamaica, and its data is not as plentiful as that of the other countries, but we wanted to include a smaller country. And we really wanted to just share the nature of the results. And it would seem that what we found originally for Argentina is reproduced with quantitative differences, but qualitatively, we saw it in the other countries as well. And briefly, before we end, where can we find more information about this model if anybody would like to read about it more in depth? We have a publication. It came out last year. I don't know, Adrian, if you're there, maybe you can put the link in the chat. It's a +1 publication that describes the characteristics of the epidemiological model. And there are two other publications that are under review right now for the cost effectiveness portion of it. And there's another one that's about this epidemiological-economic integrated model in the countries. And there's also a working document, that we circulated, including most of these results and using this model. And we can also give you the link. It's two groups of working documents. If we have a minute, we can share that with you now. That would be great. Thank you. Ana Milena, you have the floor. You're muted. Thank you. Can you hear me? We don't have much time left, so we wanted to thank the IECS team for this very important contribution. We want to thank our panelists for this very thoughtful and interesting discussion, and all of our participants who were with us today during this webinar. As the authors of the study have said in the chat, you can find the link to the model, so you can try it out yourselves. And before we close, we want to invite you to take a look at our publication, Beyond the Normalcy, Más allá de la normalidad. It looks into the consequences of the pandemic on our health systems, as well as the challenges regarding expenditures and investments. I think it will be a very interesting complementary information to what the teams have presented today. So farewell to all of you. Thank you very much for being with us.